So, continuing with Piroxicam. Piroxicam has an onset of action pretty late than most of the other NSAID. It starts somewhere at around 1 to 2 hours after giving the drug, and the peak reaches at about 3 to 5 hours. And the duration of action is like the longest among all, which is somewhere about like 1 to 2 days. Right. Now, before going on to the GI risk and indication, we must know the dosage of the Piroxicam. The dosage come in two format, 10 milligrams and 20 milligrams tablet, right? And you can still give somewhere around like 10 to 20 milligrams once a day. That is, in 24 hours, you have to give maximum of like 20 milligrams, right? So maximum dose will be 20 milligram per day. And similarly over here, maximum dose will be 20 mg per day. Now if you increase the dosage, right, there will be a higher risk to cause the GI bleed. So the GI bleed will occur if you will start a dosage of about more than 20 mg per day. And as you keep on increasing the dosage, there will be higher and higher risk for the Piroxicam. Now before going on to the indication, let's quickly review Piroxicam from our important table. Piroxicam is over here, and the Piroxicam has the worst antipyretic action. It has the worst antipyretic action, but it has pretty good analgesic effect and very good anti-inflammatory effect. However, at the same time, it can cause a heavy GI bleed. Right? Only 3 drugs were in the table who were causing the highest GI bleed occurrence: aspirin, right, ketorolac, and the Piroxicam. However, at the same time, for the anti-inflammatory action, it is one of the best potent drug that you can give for anti-inflammation, alongside with the analgesic effect. Right. So we were talking about the Piroxicam. Now, because it can act for literally about for 2 days, so it can be given for chronic inflammatory states, which is none other than the arthritis. Now the thing is, there are a lot of chronic inflammatory condition, right? There are a lot of chronic inflammatory condition other than the arthritis. However, the severity and the how much fast it actually develops depends. Now in that condition, you can go with some other drug. For example, you can use the corticosteroid. But in such condition, who is like slowly progressing, and over time, maybe it can be not fatal, but it still can make you have a bad lifestyle, right? So you can use you can use it for the arthritis. Now, because the spectrum is so much narrow and the risk for the GI bleed is so much high, so accordingly we can choose the PPI. For the PPI, we give the lansoprazole. It is again once a day, and we can go for about 30 milligram tablet. So Piroxicam can be adjuncted with lansoprazole. Whenever you give somebody a Piroxicam, give 30 mg OD lansoprazole alongside with the Piroxicam. Right, so this was all about the Piroxicam. We'll not talk about the dosage and other combination, because Piroxicam is again it is very good drug for the anti-inflammation. However, because of the drug dosage level, which can cause the GI bleed at a very low level, you can add Piroxicam with ceratopeptidase, or you can use Piroxicam with paracetamol, or you can add Piroxicam with chymotrypsin. Right, all this combination actually help us to decrease the dosage of 20 milligram OD, and at the same time we can also use other combination which actually help us to decrease inflammation. Right, so better than using Piroxicam alone, you can use the combination system of Piroxicam, which is the Piroxicam with ceratopeptidase, or the PCM, or the chymotrypsin.